Hello, everyone, and welcome to our Facebook Live. It is officially Eating Disorder Awareness Week. So, we are joined here today with Carly Rupiper, who is from the Boys Town Pediatric Weight Management Clinic. We're going to talk all about eating disorders, what parents need to know, and what to look for if you suspect that your child may have one. So, Carly, thank you so much for joining us for this very important topic. If you want to start just by introducing yourself, telling us all a little bit about the Spark Clinic, that would be great.
Yeah, well, thanks for having me. I think this is a really important issue to be discussing and bring awareness. So I'm a nurse practitioner, and like Abby said, I work in the Spark Clinic here at Boys Town Hospital, and we focus on mostly dealing with disorders that lead to increased weight and having health issues from that. So just a little disclaimer that I'm not necessarily an expert on all eating disorders, but I have a good understanding of the variety of them. And the Spark Clinic, we kind of focus on health as our primary goal for our patients and our kiddos and our families, is just improving our health and not just looking at weight necessarily in those numbers, but working on the better habits to have better health, such as our looking at what we're eating and eating for nutrition and eating for health, increasing our exercise, having good sleep, good mental health, all those components that give us a healthier body.
That's great. Well, like I said, great to have you. And if you're tuning in live with us and you have any questions for Carly as we go through our live discussion, please feel free to leave them in the comment section of this video and we'll get them answered. Please also make sure to give this video a like and share with your other friends who are parents so they can get this information too. Okay, so like I said, it's National Eating Disorder Awareness Week. Let's get a little bit technical here so we can start off on the right foot. Carly, how is an eating disorder defined?
So different criteria we look at depending on the type of disordered eating, and it's important to note too that eating disorders can come in all shapes and sizes. I think we associate it with being girls only that are extremely thin, but that's not often the case. And so we have the anorexia nervosa type of eating disorder, and that's more with kids who want a very, very tight control and are extremely restrictive of what they eat. And then you have bulimia nervosa, which is a type of kind of being restrictive with food, but also then having periods of binge eating with food, of eating mass amounts of food and having a loss of control, and then needing to get rid of that amount of food by either purging or vomiting, self-induced vomiting, extreme exercise, or sometimes the use of laxatives too. And then we have binge eating syndrome too, which is found in all shapes and sizes in kiddos and adults. But that's a loss of control eating where there's just lots of food eaten at once, and kind of a feeling of guilt and shame followed with that too. And then there's also night eating syndrome, which is kind of becoming a little bit more identified in the community amongst kids, of just eating very large amounts of food in the middle of the night.
Okay. Yeah, so there's a lot of different types, as Carly just listed. And just as you said, it can range from boys to girls to teenagers to younger kids. There really isn't, a demographical limit to these eating disorders. So we're going to talk more throughout this live on, signs and symptoms of those conditions. So just touched on the different types. How do eating disorders come about in kids? Is it usually attributed to societal pressures, pressure at school, among friend groups, or can it be hereditary, or all of the above?
Yeah, it's definitely multifactorial.
Yeah.
It's something we don't think of being a hereditary kind of thing, but it does run in families. It's kind of a behavior or a learned behavior sometimes. If a parent struggled with body image and eating habits, oftentimes a child will see that too, and sometimes have the same struggles and issues. Society, I think, really pushes that we should all be very thin and skinny, and that's what we should look like. And they have advertisements showing models that are that they do the editing to the pictures, to the photographs, to make them look thinner than they really are in real life. But there's just this push, this marketing campaign, and with the social media too, with kids comparing themselves to other kids all the time, and just saying, I want to look like that, and why can't I be like that? And life will be fine and better if I look like that too.
Mm-hmm.
And something else we're seeing commonly is that that competition in sports to have a certain body shape and size. Wrestling with boys is something that's I've been researching that's seeing a little increase in eating disorders because of needing to cut weight sometimes and being very restrictive with the eating to get at a certain weight. But swimming, gymnastics, cheerleading, tumbling, in other sports too, I think there's a big pressure to perform better if you're at a certain body size and weight, unfortunately.
Mm-hmm. Yeah. So let's say, some of these kids in our families and at school, friends of friends are kind of facing some of these pressures. What are the signs that parents can look for if they think something might be going on?
Yeah, there's definitely some signs that should be red flags for parents or friends or family members. If we're worrying more about somebody being really restrictive with their eating, are they avoiding eating? Do they not want to eat in front of everybody? Are they having complaints all the time of like, I don't feel good, my stomach hurts, I'm just not hungry yet? Are there changes with menstrual cycles? Sometimes that can be a huge red flag that they're not taking enough calories now to have normal menstrual cycles too. When we're worried more about the bulimia nervosa type, do you see any changes to the kiddos' teeth? Are their teeth starting to lose that enamel? Gums look unhealthy from the constant vomiting, the acid coming up in the mouth. Are they stashing maybe wrappers in places to avoid having anybody watch them eat because they know they have guilt over their eating or the binge eating episodes? And sometimes are there huge containers, empty containers found in the trash sometimes too that don't make sense in the house. So those are some big things to be looking for. But also like what's going on with their mental health too. Are they feeling, is the kiddo feeling more anxious lately, under a lot of stress, depressed too? You need to be looking at those red flags. Something we see sometimes in our clinic, or something that I'm always looking for, are changes in weight. Obviously, did the kiddo have a lot of weight loss all of a sudden, clothes looking baggier, or are they wearing different clothes to hide their weight? Has there been a really big increase in the child's weight? Are they eating to kind of comfort themselves for something bad that's happening in their life too, or to get people to not want to look at them anymore? So all things to take into consideration.
Mm-hmm. Yes. So if parents suspect that their child may be struggling with an eating disorder, what is the first step you would recommend that they take?
Yeah, and it's important to really take this seriously and not just think, oh, it's just a phase or it'll get better. This is it's a serious mental health condition where these kiddos either have like such tight control over wanting to achieve something, and or they have a complete loss of control of how they want to or know they should be eating. And so these kids are often either very high achievers and need to be perfectionists, or they need a lot of help and support. So it's usually something you need to talk with your primary care doctor about immediately. Bring up these concerns, have a visit with them to sit down and just kind of, maybe answer some questions the primary care doctor might have. We have a lot of standardized questionnaires that really help determine, based on a scoring system, is this a disordered type of eating, or maybe this is something just like depression or anxiety too, or a combination, which is extremely common.
Mm-hmm. Yeah. So, how are eating disorders treated? I know you listed several different kinds. Are they all treated differently, or what's that process look like?
The main backbone to treatment, regardless of the type of disordered eating, is a comprehensive treatment approach involving the primary care provider, but also usually individual behavioral therapy, family behavioral therapy, meeting with a dietitian, and then also maybe using medications too. And so sometimes this can be very intense therapy and treatment that can take a while too. So this is not a quick overnight change. This is kind of a chronic condition in a lot of ways.
Mm. So, with those treatment options, is you just said, it can take a long time. Do a lot of families kind of see like ups and downs? You know, it's almost in the sense of like an addiction. You can go to treatment and then be done with it and be better and then fall back into it. Is that pretty common with eating disorders as well?
Absolutely. There's ups and downs, and there's a lot of triggers and stressors that can happen in a kid's life that bring on those feelings again. I have to say, in my professional career, I've seen a lot of cases where kiddos said it was this one time, this one person said something to me that stuck with me forever and really led to this way of disordered eating. And then every time something kind of in that similar situation comes back in their lives, they sometimes have some moments where there's ups and downs, and we have to maybe intensify treatment then for a little bit to help them get through that period. So yeah, absolutely.
Yeah, and that's just echoing your point again on how serious parents need to take it, because I know, especially during those teen years with boys or girls, you can think like, oh, they're just going through a time with their friends or they're just being dramatic, but this is definitely a serious thing that we are trying to spread awareness of during National Eating Disorder Awareness Week. So, thank you for sharing that.
Yeah.
We have a couple more questions here. And then if you are watching live, like I mentioned earlier, please comment any questions for Carly and we can get those answered too. Okay, so how can parents support their children through treatment?
This is very, very crucial, and this can really make or break a child's treatment. This can be kind of a lot of changes for a family to make, but it really has to be done on the family level. And if a therapist or gives some recommendations or advice saying, as a family, we really need to do more of this, take it seriously and don't kind of just think, well, we're going to keep doing this, but we'll change other things. It really has to be an all or none approach. And a lot of sometimes the feelings of needing that control are because of things going on in their close personal life that the parents might not be realizing could be causing some of those issues with their eating. So just really take that advice that they get from the professionals to heart and really work on those changes and have consistency for sure.
Mm-hmm. With that, what about siblings? Because some siblings might be younger and not really understand what's going on with their older sibling, or even how can siblings that are older be supportive during that time?
Yeah, and that's a good point too, that they might not understand like why their sibling is feeling that way about their body. And when they're like, no, you look fine, you're healthy. So I think it's just as a family, especially, just have those talks about health. We just want to be healthy. We're not just so concerned about the way we look, and we're not singling anybody out. It's going to be an all family approach towards we're going to eat this way and do the right things for our body in terms of our nutrition, and not kind of single anybody out.
Mm-hmm. Great. So, with that, kind of building on it, how can families create a positive environment at home surrounding food and exercise so we aren't creating stigmas that could contribute to disordered eating?
Yeah, and this is kind of where it all comes down to, like, how do we talk about health as a family? Are we constantly viewing it as if somebody is skinny or thin and they're healthy, or they are more attractive or more likable? That can really do some damage to a child that hears that from their parents, especially. And model good behavior too. If you're a parent and you have a lot of body image issues or poor self-esteem, and you're constantly kind of displaying that or discussing that from your child, it's monkey see, monkey do. They're going to do the same thing and have the same worries and concerns about their own body and not feel healthy and good in their own skin. So, they're watching. So make sure you have good body image talk amongst yourselves and do healthy things and demonstrate having a good balance of healthy foods to say, like, we eat these because this is healthy and we're nourishing our body. And then the other thing is, we'll kind of just be aware of how we talk about food. I don't like in our clinic to say there's good food and bad food, because we never want kids to associate, if I eat a bad food, I'm bad, and that could kind of spiral into some disordered eating. So we eat healthy food and it makes us healthy. If we eat unhealthy foods, it might not help us be healthy. So talk about food in that way.
Mm-hmm. Yeah, that's great advice. And we do have linked above this video a Spark email series. So it's our little healthy newsletter. You get healthy eating tips and tricks and exercise advice sent to your inbox so they can give you additional good ideas on how to do that within your own family. Okay, so Carly, the last question is, what do you think is the most important thing parents should take away from this chat during Eating Disorder Awareness Week?
Oh, kind of like we talked about, this is a serious condition, no matter what the spectrum of the disordered eating, but can lead to some serious health issues. Even unfortunately, death sometimes if treatment is not given to some of these kiddos. And it's a lifelong thing, as we said. Will never just kind of go away and all be better. But you have to kind of really make these changes for for a long, long time and support the kiddos in knowing what they feel in their head is legit. You can tell them till you're blue in the face that they're healthy and that they have a great body, but in their minds they are not that same person. And so you have to just be very understanding and patient and kind to them too, to understand they're just going through a lot, and this is a very, very problematic disease.
Yes, thank you so much. And for those of you who are watching later on after this live session has ended, if you find yourself having more questions for Carly related to eating disorders or the Spark Clinic in general, you can always message our Boys Town National Research Hospital Facebook page, and I'm happy to coordinate some dialogue back and forth between you two or put you in contact. So Carly, thank you so much. This has been a really good chat, very important, as we mentioned, and it's great to always have you on.
Absolutely. Thanks for having me.
Yes. All right. Well, thank you everyone for tuning in, and we hope that you continue to find resources throughout this week to educate yourself and others on eating disorders. So thank you so much, and we'll talk to you next time.
Thank you.